Hi guys, I'm Saskia. I'm a psychological wellbeing practitioner and OCD counsellor at Private Therapy Clinic, and I thought I'd do a video explaining a little bit more about what exposure and response prevention is. So exposure and response prevention, also shortened down to ERP, is a specific type of cognitive behavioural treatment. Now, in ERP, the practitioner and the client will work together to generate situations or stimuli that will induce anxiety in the client. And they'll encourage the client to stay within these anxiety-inducing situations. And now that's the exposure part of the treatment. And they'll encourage them to do this without resorting to compulsions, which is the response prevention part of the treatment. And this ERP is the most effective treatment for OCD, but it is also effective in treating other disorders, for example, specific phobias, generalized anxiety disorder, and also PTSD. And the reason it tends to be effective in treating these disorders is because it shows the client that whilst their fears are real, they're not as realistic as we would ideally want them to be, and they also are not as threatening as they might originally think. So cognitive behavioural therapy is an overarching evidence-based psychological treatment that can help in various areas of mental health. And the main thing it focuses on is the relationship between thoughts, feelings, behaviours, and also physical symptoms as well. CBT usually entails things like structured collaborative sessions, challenging maladaptive thought patterns and negative thought processes with more helpful thinking patterns, and that's called cognitive restructuring. It also involves a specific treatment plan with clearly outlined goals and objectives, and the main thing it focuses on is identifying these kind of relationships between thoughts, feelings and behaviours, and also where it is best to interrupt any negative cycles that are happening in between those. So CBT can help people and clients feel more empowered in their lives, because by identifying that thoughts are subjective and can therefore be challenged, clients can improve their self-confidence, relationships and mental health as a whole. So ERP is a type of cognitive behavioural treatment because it involves cognitive and behavioural aspects. So individuals learn to challenge their thoughts and also they learn how to challenge their compulsive behaviours as well. And note that I say challenge, not control. That's a very, very important focus to have, especially in the case of treating OCD. We have to realise that we can't control our thoughts particularly, but we can challenge them. So as I said, ERP therefore tends to be most effective when used as an aspect of cognitive behavioural treatment, and that does tend to be the case when treating generalised anxiety disorder, specific phobias and PTSD as well. So what should you expect with ERP treatment? As I mentioned, ERP is part of CBT, so it is structured, it's evidence-based, and it's often delivered by mental health professionals. Now, as with any other therapy, there are no guarantees, but many people report significant improvements after completing ERP treatment, and also the NICE guidelines, so that's the National Institute of Care Excellence, they recommend CBT and ERP as a component of that as the most effective treatment for OCD, for specific phobias, and also some aspects of PTSD as well. Now, when beginning the process of ERP, you will start with an initial assessment. Now, this initial assessment entails a thorough assessment of your developmental background and also your psychological history. So this will involve your practitioner asking you many questions about your childhood, your past, your current symptoms, how they may affect your life right now, how they've affected your life in the past, and they'll allow you to kind of bring up any concerns you may have, and kind of talk you through the treatment plan. So that is kind of the initial assessment, but then throughout the ERP process, you will probably be introduced to a number of different clinical terms that are quite new to you. So I'll go through some of them here to give you kind of a bit of an idea. So psychoeducation is one of the first clinical terms you will probably come across, and it just refers to your practitioner explaining particular concepts to you. And their explanations may include relevant statistics and research, common symptoms associated with your condition, expected treatment outcomes, and also alternative treatment methods. So any questions relating to any of those areas that may come up during the psychoeducation process, just ask your practitioner. They want you to feel empowered and knowledgeable because this helps you feel more capable of carrying out the ERP treatment, and that motivation is very, very important. So any questions that you may have that come up during the treatment process, but also during your own research, if that's something you'd like to do, just ask the practitioner because they'll be happy to talk to you more about it and kind of provide that clarification. So your therapist will most likely ask you to come up with and indicate various different anxiety-inducing situations, and they'll ask you to rank these different situations in terms of least distressing to most distressing. So for example, if your fear and your obsession is contamination, it may be that you would rate the situation of giving someone a hug maybe a 6 of how much it would cause distress, but not washing your hands after going to the bathroom would be rated a 9. And this creates this kind of fear hierarchy, which allows your therapist to structure your treatment. And as the name suggests, exposure and response prevention, your therapist will gently encourage you to start exposing yourself to these fears. And this exposure is gradual and it's controlled. So you will have very much a say in which one you want to move to next. Your therapist will help you break it down into very small, manageable steps, and they won't push you into a really, really distressing situation without your kind of consent, and things like that. It will be anxiety inducing. Each step will be a bit more anxious. However, they won't just throw you in at the deep end, kind of like that old flooding technique, which used to be people throwing to cure a fear of water. They would throw them into the water straight away. No worries, that is not what this kind of hierarchy is. It's done in small, manageable steps that you have a lot of control over as well. So exposure therapy operates under the assumption of habituation. So habituation happens when we become desensitized to certain stimuli after being exposed to them time and time again. So for example, let's use water again. Think about if you go into the sea, especially in England, if you go into the sea, at first it may feel freezing, but after a few minutes your body adjusts and it doesn't feel so cold. And the same thing with kind of if you move to somewhere that's near the train tracks. At first the trains may really bother you, keep you up at night, but over time you become desensitized to it and you may not even hear them anymore until you realize they've stopped one day. So that's the kind of process of desensitization through habituation. Now the exposure part of ERP works with this, and it utilizes habituation by exposing clients time and time again to a stimuli that would usually cause them anxiety until it doesn't cause them anxiety anymore because they've become desensitized to it. Now, as I mentioned in the past, clinicians would use a technique called flooding, which was kind of throwing you off at the deep end. And today therapists would not practice this way. They would never it would all be gradual exposure. So instead of kind of throwing you in off the pier at the deep end to treat water phobia, it would be things like, first of all, showing you maybe a picture of someone swimming. Then after that, it would be dipping your toe in a pool. Like I said, you kind of work with your fear hierarchy in manageable steps that you both come up with together, until you become desensitized to that smaller step, and then you move on to a bigger step and that kind of thing. So there may be many, many steps that would help kind of work your way through your fear. So ongoing habituation is a key component for managing obsessions. The more you surround yourself with a fear, the less frightening it feels because you realize it's not quite as threatening as you may think. Response prevention is also sometimes known as ritual prevention, and its main aim is to neutralize the anxiety associated with an obsession. As aforementioned in this video, what response prevention is preventing the client and helping them to abstain from performing compulsive behaviours in response to an obsession. So after the exposure exercise, the client will be put into this anxiety-inducing situation, and the whole part of response prevention is preventing them from performing compulsive behaviours in order to alleviate the anxiety associated with the obsession that's been triggered. So at first, this abstinence will feel pretty agonizing because you are changing very, very deeply rooted behaviors and habits, and it's normal to feel a heightened sense of anxiety. That's part of how the whole process works, that kind of habituation to this anxiety. And like I said, over time, the anxiety will lessen. The more you abstain from performing compulsions, the less you'll feel the need to do them. And not only that, but also the less intense obsessions become, the less anxious these obsessions become, because you're essentially retraining yourself how to respond to obsessions. And as mentioned in kind of all my OCD videos particularly, but also kind of it works the same way with other anxiety disorders like specific phobias and stuff like that. Whilst compulsions do initially alleviate some anxiety associated with obsessions and anxiety-inducing situations, it actually over time basically it just increases your preoccupation with that anxiety obsession, so it's going to become more frequent. So the more that you abstain from those compulsions, the less intense and most likely less frequent those obsessions will become. In order to make the most of your ERP treatment, it's not really enough just to show up. You do really have to put the work in, and that's the case with all CBT treatments. The more work you put in, the more you receive as a result. So it's kind of good to look at it in a way that you're investing in your own growth. Now, there are a few tips I'd like to give you, and I'll outline them now, that will help you kind of prepare yourself for CBT and ERP in particular. So one of the tips that I would recommend before beginning ERP treatment, but also maybe CBT as a whole, is knowing that treatment can be uncomfortable. So particularly for ERP, it can be really challenging. You're trying new things, you're confronting some of your greatest fears, so be kind to yourself during this process. And your therapist may even tell you that things may feel worse before they feel better. And this phenomenon is quite common within all mental health treatment, because having to sit with discomfort is difficult, and you may feel quite triggered to carry out compulsive behaviours or safety-seeking behaviours in order to deal with the anxiety caused by these treatments. But just remember that this discomfort is temporary. The more that you learn to tolerate such anxiety, the less anxious these things become, and the easier it becomes to kind of sit with these situations and sit with the discomfort. The biggest tip I can probably give anyone beginning CBT treatment as a whole, but also ERP, is reiterating how essential it is that you complete your homework. I can't reiterate this enough. It is so important for you to do the homework that is set to you by your therapist. So they will set you specific exercises to complete in between sessions, and this will be things like recording your own thoughts or even carrying out things called behavioural experiments. And at the time you may resist doing this homework because it can feel uncomfortable. But if you don't do the homework, it means the treatment is just not as effective, because the majority of growth doesn't happen within your sessions. It happens when you implement the knowledge you learn from your sessions into your everyday life. Another tip is to speak up if something feels too distressing. Now, everyone progresses at their own pace, and while you should feel challenged and sometimes uncomfortable, you shouldn't feel obliterated by your emotions. That's often a sign that things should be slowed down, or maybe you should even try a new direction. And try and be honest and forthcoming with your therapist regarding your concerns and your distress. Remember, they're there to help and support you during your treatment. And furthermore, they want you to feel safe with them guiding your treatment. So they'd rather you significantly slow down in the steps of your treatment rather than stop it altogether. So another tip that is good for clients who are engaging with CBT and ERP is to remember that progress requires ongoing practice. Now, it's very natural to want to be kind of OCD or phobia or GAD or PTSD free within a 6 to 12 week ERP treatment. And whilst that could be possible, it's most realistically not going to be the case. The most realistic outcome is that you're going to be better than when you started therapy, but you're still very much on that ongoing recovery journey. Now, CBT and ERP are very, very much doing therapies. You're training yourself to basically become your own therapist over time. So another analogy that maybe could kind of help kind of articulate this is learning to drive. In many people, you have your lessons, but you only really kind of become a driver and know how to drive long after you passed your test, and you've been practicing every day, driving every day. That's when you really become a driver. And we kind of think of ERP treatment and CBT treatment quite similarly to this. Whilst you're doing your treatment with your therapist, you're learning, but you only really fully recover from things like OCD or phobias after practicing every day long after your treatment has ended. And by practicing every day long after your therapy is ended, you kind of are practicing continuously and cultivating the skills over time, and you're integrating them into your everyday life. So it's essential to keep up that continuous practice in order to see the best results. Self-help therapy is definitely possible. There are many ERP workbooks and courses that you can complete, and it can help you manage your treatment and manage your condition after therapy. But most therapists would recommend you don't solely rely on the self-help treatment, that you would engage in therapy first. And this is because, as mentioned throughout this video, ERP can cause a certain amount of discomfort and distress, and you can feel worse before you feel better. So a lot of times people could give up because you're not being held accountable each week and because of excessive anxiety. And that's actually a good point as well. When you're managing your own condition through self-help, you're not fully trained in kind of creating these manageable steps and creating this fear hierarchy, so you can even cause yourself excessive anxiety, which actually exacerbates the condition. So once again, we would recommend that you engage in therapy first, because not only that, but it gives you a clear plan for treatment that is very important in kind of treating OCD, phobias, PTSD, that kind of thing. And therapy is the best way to provide that clear plan of treatment. And finally as well, when you're kind of tackling your own condition, again, you're not trained, so you may overlook certain obsessions and compulsions, and you may not realise that they are actually obsessions and compulsions, so you may rely on them even more when trying to tackle your other obsessions and compulsions. So by that overcompensation, you're not actually kind of doing the ERP work that you should be doing in order to reduce the anxiety over time. So once again, the professionals do recommend that you engage in therapy first, but self-help books and stuff can really be helpful in maintaining that treatment and continuing practicing it. So I do often recommend to my clients this book. I'll include it in the link, and it's a self-help book for OCD particularly, but there are other ERP books that you can buy and courses. But as again, I recommend my clients buy this along with our treatment so they can practice between our sessions, after our sessions, and things like that, so they have something else to rely on. But yeah, I would definitely recommend engaging in therapy first before trying to do any self-help work. In terms of how long ERP treatment takes, there's no universal answer. It does depend on kind of your mental health history, your current symptom severity, your overall engagement in the treatment. So yeah, there's no universal answer, as with most forms of therapy. But what you can expect is that improvements will take time. There's not going to be a miracle that happens within 1 or 2 sessions, unfortunately. But in terms of the NICE guidelines, they recommend 10 therapist hours of ERP treatment and CBT treatment for OCD specifically. There are different guidelines depending on different kind of disorders, but that's the main one for OCD, as ERP is the most effective for OCD. But like I said, it depends on your treatment engagement. If you're not doing your homework, it's probably going to take more than 10 sessions. And also the 10 sessions will increase depending on the OCD symptom severity. So you potentially need more. 10 tends to be kind of the minimum to kind of get you learning of how to manage your symptoms and kind of get yourself on that journey. If you're looking to begin ERP treatment, it's important to remember not all therapists are trained in ERP, and not all therapists are trained in ERP for OCD either. So if you are wanting to start ERP treatment, one good step could be to book in a 15-minute call with one of our practitioners at Private Therapy Clinic. And what they'll do is listen to what you're looking for from therapy, if that's ERP, and they'll be able to recommend the best therapist for you and your budget as well. If you or your loved one is struggling with anxiety, ERP can be a great solution because it provides long-lasting benefits and it's an evidence-based practice as well. So feel free to contact us at Private Therapy Clinic and we can set you up with one of these 15-minute calls and hopefully get you set up with the best ERP specialist.